The synthetic drug crisis in the United States is bad and getting worse. The toll these substances have had on human life and health is devastating.
It is not possible to overstate it.
Dr. Sullivan Smith, an ACEP member, Tennessee emergency physician, and an active law enforcement officer on Capitol Hill, testifying before the Senate Judiciary Committee, calling for more action.
We know it's a huge problem as it exists based on the cases we know about. The problem is there's not good medical testing. We can't test for these drugs. We can't prove it in your system. There are a lot of people who die that you simply don't see those drugs listed in toxicology.
Dr. Smith told lawmakers that illicit, synthetic, or chemically enhanced drugs are readily available, widely used, and growing in popularity. Every legal step possible must be taken to control them.
We see the tip of the iceberg. It is much bigger than we know.
These drugs cause psychotic and violent behavior in users. A problematic loophole for law enforcement is that many of the chemicals in these drugs are often sold legally, labeled not for human consumption, to mask their intended purpose and get around federal drug laws.
You know, the drugs are changing every day. There are newer ones, more potent ones. Long-term effects, we just don't know.
Emergency physicians are seeing it. According to a recent ACEP poll, more than 95% of emergency physicians have treated patients for synthetic drug use. Additionally, 9 in 10 saw violent acts in the emergency department within the past year. Dr. Smith says he came to Washington with very key goals in mind.
To change the bureaucracy, to become more nimble, to be able to address these drugs as they're identified as problems.
For more information on synthetic drugs, please go to our website at www.acep.org.